Fast facts: overcoming barriers to treatment of overactive bladder, or OAB. Today, you will learn more about the impact of stigma and other barriers on the timely diagnosis and treatment of OAB, often hidden desire for treatment among patients with OAB, and potential ways to assess for underreported OAB symptoms among patients in your practice. Although OAB is prevalent, it often goes undiagnosed or untreated. Studies have shown that patients feel their OAB symptoms bother them enough that they want their healthcare provider to address them. In one study, 1/3 of patients believed it was very important for their OAB to be treated. Yet, patients may delay seeking medical care, often waiting until their symptoms are severe or uncontrollable. On average, patients wait 3.5 years from symptom onset to treatment initiation. Wanting treatment but delaying seeking treatment may represent an unmet need in patients with OAB. Why do patients delay seeking care? Barriers include social stigma associated with incontinence, patient embarrassment about symptoms, misbeliefs about OAB symptoms. Additional barriers to diagnosing and treating patients with symptoms of OAB may include lack of a patient-provider relationship and effective patient-provider communication. This can result in an environment or setting that is not conducive to discussing symptoms. This can also result in patients falling through the cracks when there is a lack of provider follow-up. Lack of effective communication between patients and providers. This can result in undertreatment, decreased clinical effectiveness, and decreased medical care satisfaction. So we've established that patients may not report their symptoms, resulting in late diagnosis and treatment. What can we do to help uncover undiagnosed OAB? Utilizing a patient-centered care model may help foster patient-provider communication and increase identification of OAB. Patient-centered care involves the patient in their healthcare plan. It has been associated with better health outcomes, improved patient satisfaction, and reduced healthcare costs. Patient-centered care often comprises health promotion, in which a patient's past and current health are taken into consideration to develop a healthcare plan. Partnership between the patient and providers so that both parties can collaborate on a healthcare plan. Effective communication so that the provider fully understands the patient's healthcare experiences. The goal of patient-centered care for patients with OAB is to create a collaborative, secure, and sensitive environment that promotes openness. Healthcare professionals can also work with patients to foster identification and treatment of OAB by educating them on the condition, including symptoms and impact, raising their awareness of the available treatment options, managing patient expectations about treatment benefits, and clearly defining realistic treatment goals and strategies. In summary, on average, patients wait 3.5 years from symptom onset to treatment initiation. Barriers exist to timely reporting of symptoms, including social stigma, embarrassment, and misbeliefs about OAB symptoms. Additional barriers may include lack of a patient-provider relationship and effective patient-provider communication, all of which can lead to delayed diagnosis and treatment. Utilizing a patient-centered care model may help foster patient-provider communication and increase identification of OAB. The goal of patient-centered care for patients with OAB is to create a collaborative, secure, and sensitive environment that promotes openness. Are you ready to uncover undiagnosed OAB in your practice?